There's a lot of information out there about COVID. Some of it's true and some of it's not.
Our Verify team talked to an expert at Johns Hopkins University to separate fact from fiction. Here's investigative reporter Cheryl Mercedes.
There is a new strain of COVID-19 called Delta Plus.
True. There are multiple different variants that are developing, that are circulating, that are evolving. One of those goes by the colloquial name of Delta Plus. And what it appears to be is the Delta variant with some additional mutations in it. There's no reason to panic about it. However, it doesn't seem to be acting any differently than Delta, but you should expect that there are going to be more variants as this virus continues to evolve and continues to infect people.
If you had COVID-19 over a year ago, you still have antibodies and do not need to get a vaccine.
False. You do have antibodies after you've recovered from COVID-19, and you do have some protection. But what we know is that that protection may have decreased over time, especially as you approach 1 year, and you may be at risk for reinfection.
The LAMBDA variant of the COVID-19 virus is resistant to the vaccines that have been created so far.
False. We're not seeing resistance when it comes to what severe disease, hospitalization, and death. There had been some early reports that the LAMBDA variant has some mutations that pose problems for the vaccines, but I think it's really important to remember that the vaccines were never designed to stop every infection. They were meant to stop serious infection.
The vaccines cause your body to make spiked proteins, and those proteins are like the ones that make the COVID-19 virus. These spiked proteins may damage internal organs.
False. While it is true that the vaccines induce your body to manufacture spike protein so that your immune system can see it, those spike proteins are not very long-lived, and there's no evidence that those spike proteins are causing damage to your body.
If someone waits 6 months to get their second dose of a 2-dose vaccine, is it still effective?
True. Even if you wait past the 3-week or 4-week window and get your second dose of the 2-dose shots, they're still going to be effective. In fact, there is evidence that they might be more effective.
Good information there. The Verify inbox is filled with questions about COVID. Viewers wanting to know what's true and what's not about booster shots and antibody treatments.
Tonight at 6, Cheryl will get those questions answered for you.